All right. So the topic that I prepared to kind of speak around today is the world of laboratory assessment. And I think if you were on the thread of the first meeting we had, Dr. Karen went over conventional lab work. And so that's more the traditional blood draws you do when you go to the lab. Most doctors send you to the lab to look at your liver and kidneys and metabolism and thyroid. So today, I wanted to talk about some of the other tools we use as naturopathic physicians to kind of assess what's going on in our body amongst many other tools of assessment we use. So I wanted to ask if there are any areas specifically where people are interested in learning more. Meaning the idea of this open forum is really to engage with your questions and what you're curious about. So I really don't have any agenda of what direction this goes in. And so I wanted to just ask if there is any desire of any certain topic area, types of testing that I can just go into. So feel free to unmute yourself and ask, or send a chat question, and I'll just hang here for a sec for that. Nobody has anything. Okay. Well, let's start then. I'll just get to talking about some of the labs we do have. Oh, here we go. We got a couple. Hormone testing. That sounds good. I was definitely thinking of starting there. Any other ones that anyone has to shoot out there about what they're interested in? Thyroid testing. Okay. Okay, cool. So it sounds like hormones are a big theme from a lot of people on the call. So let me just kind of break things down with hormones. And I like to kind of be the type of person that zooms really far out, and then we can zoom into the test rather than just start talking about the test. So I think really practically speaking, the first question to ask is, why would we want to test for hormones? What would bring that up in a health clinical situation? So first of all, I guess we would have to name that. What are hormones? What do they do in our body? And hormones turn out to have quite a few roles in health. A hormone is a signaling molecule that tends to be created in different glands in the body. And so depending on which hormone we're talking about, depends on which gland they are made in the body. So thyroid hormone is made in the thyroid gland that sits right at the bottom of the neck. And reproductive hormones, which for women are progesterone and estrogen, and for men are testosterone. They're made all in both, but more prominently depending on the gender. The estrogen and progesterone in women are made primarily in the ovaries, and then after menopause, primarily in the adrenals. And in men, testosterone is made primarily in the testes, and then as age progresses, less so and more so in the adrenal glands. The adrenal glands are very small glands, but have very powerful action. They sit right on top of your kidneys. They also create another really important hormone in the body, which is called cortisol. And they also create epinephrine, which is a important adrenaline hormone. So cortisol, we think of more as a stress response hormone. And there are a few other hormones, but they're not as widespread in clinical application. We could talk about prolactin, growth hormone, oxytocin. Insulin is also a hormone. I guess insulin's a pretty important one. Insulin and glucagon. These are hormones associated with regulating your blood sugar and metabolism response. However, for our purposes, They tend to be not as important for testing, although I will try to mention them. So I think the ones that I want to talk a little more about are probably the reproductive hormones and thyroid hormone and adrenal hormones, because those tend to be really relevant to clinical presentations and involved in a lot of health disturbance patterns. So, looking at hormones, I would start in probably first with the thyroid. And why might we want to test the thyroid? Turns out thyroid's involved in regulating as a signaling molecule a lot of different processes in the body. So it regulates temperature, it regulates metabolism, it regulates heart rate, blood pressure, it even regulates the tone of our nervous system, how our bowels function, how our kidneys and cardiovascular system function. There are major modulating effects on it. And the thyroid gland, when it's abnormally functioning, can lead to a lot of different symptoms. Most commonly, the thyroid gland underfunctions as a problem in our culture. And symptoms we often characterize as associated with it are things like fatigue, constipation, depressive symptoms, cholesterol abnormalities, hair loss, dry skin, sleep issues, hyperinsomnia, insomnia, to name a few. So it's an important thing to screen in a lot of folks. And thyroid hormone, it turns out in terms of a testing modality, is most appropriately actually assessed by the blood. So that would be more of a topic that Dr. Karen covered in her last meeting with y'all, if you were on the call. And because blood tests, we tend to think of a more conventional mode of testing parameters in the body. And so one important thing to note, though, about the thyroid testing is that conventional doctors are often very narrow in their testing window. They usually will often only test TSH, and TSH is actually the thyroid stimulating hormone, which is a hormone the brain secretes to communicate to the thyroid about what hormones to produce and in what quantities. So that's a really important marker, but it turns out that we can measure other parameters of thyroid function, such as free T4 and free T3, which are the actual thyroid hormones the thyroid is making. And that can be really important when we're optimizing thyroid function or assessing the appropriateness of medication dosing and form, to really know what those numbers are reading, because the TSH could be normal and those could be somewhat abnormal. I like to see, in a perfect world, free T3 between about 2.8 and 4.2. And I like to see a free T4 between 1.0 and 1.4. The TSH number, which is that thyroid stimulating hormone from the brain, tend to like to see that between 0.5 and 2.5. So those are kind of some more optimal numbers for thyroid from those main hormones. And then the other important one to remember is the thyroid antibodies. These are antibody markers which confer knowledge of autoimmune disease being present or not. Thyroid issues can be caused by a lot of things, but the most common cause of thyroid issues is an autoimmune process, meaning a self-attacking process going on with our immune system toward our thyroid tissue. So really helpful to know if that's going on, because it really changes the way we approach the treatment and management of the thyroid dysfunction. So a little bit of extra time on thyroid, although I'm going to leave that now since it's not really a quote unquote specialty lab that we do to test that. I will mention, just because we're talking, the other hormone I tend to like to test in the blood is testosterone. And it's just, to me, for men especially, but also women, it's shown to be the more accurate marker of testosterone levels. The other versions of testosterone testing are a little bit unreliable and unpredictable. They vary too widely. So testosterone for men, I will tend to look at in the blood, and I usually like to look at total testosterone. And if we're looking for kind of an optimal range, that's a really age dependent situation. Whereas thyroid is not very age dependent, should always be functioning pretty well through our lives. The testosterone peaks at about age 18 or 20, and then it's a big downhill slide from there on out. And so, an optimal thyroid range will really depend on your age. And so, our testosterone range. And so, again, it's really hard to give a good range here. Tends to be for men that we really look at testosterone when complaints revolve around energy levels, libido, erectile dysfunction. Those, of course, are pretty broad complaints, especially the fatigue. So a lot of other things can cause that. And even if the testosterone is low, we still have to really ask the question, what's causing the testosterone to be low? Same story with all the hormones. When hormones are low or high, the fact that they're low or high in and of themselves is helpful on some level, because addressing the low or the high can help a patient feel better. But understanding that when you address something, especially if you're giving a person hormones, those hormones have other effects on the body, much like taking drugs has the desired effect in other side effects. Well, so does taking hormones. So I'm a big believer in my philosophy as such that our bodies are designed to be very intelligent and to take care of themselves when put in conditions for health. And so it's always going to be my effort and kind of relationship with my patients to really seek to understand if hormones are depleted, out of balance, what is the underlying process driving that disturbance. Many things can be involved. Genetics, of course, which is not one we can change very easily, but still, a factor. Stress, emotional, mental well-being, big factor to influences hormones. Digestive health and nutrition that associates with that, and the quality of our assimilation and absorption, big area of focus. Metabolism, how well we're regulating our different macronutrients and distributing them in the body. Toxic burden, the presence and existence of toxins on the tissues and in the glands and the areas where hormones are produced can have a big action on imbalancing those processes. And then I would also probably argue that depletions of various nutrients, vitamins, minerals, and food and plant nutrients can also very much influence the abilities of the various glands that produce those hormones to adequately produce them. And then obviously the signaling communication between different tissues in the body, both from the function of the brain as well as how well we're circulating our blood and distributing it, therefore moving the hormones, moving the signaling molecules, that's also very important. So I guess I'm saying all of this because there's the realities of the testing, but then there's what does this really involve in terms of what we do about those findings? And I just want to say that my style of practice is not just let's get the labs to look better, whether they're specialty or conventional. The labs are not what we care about, right? It's how you feel, what your equilibrium is, what your vitality is. That's what we're trying to key in on. And while balancing hormones and doing other lab assessments can help understand where support is needed, it doesn't ultimately answer the question of what's driving and causing a depletion or imbalance. Okay. Any other questions that people have? I'm just going to pause for a quick sec. Feel free to pop them up into the chat. I am monitoring that as I talk. I'm going to circle back to hormone testing because that was where we left off. And I want to drive a little bit more into the reproductive hormones. And I want to also talk a little bit about adrenal hormones. So as I said, hormones are signaling molecules. And so they are secreted into all different fluids and tissues in the body. They're secreted into our blood. Um, they are also secreted into our saliva. And then the body breaks them down in the liver primarily. And the metabolites of those breakdown products come through our urine. So we already kind of talked about blood. And yes, you can monitor estrogen, progesterone, cortisol in the blood. In my opinion, they tend to not be so accurate because they don't really give you the free version of the hormone in order to understand that kind of action end of the hormones. So you have to understand that several of these hormones in the body exist as bound or unbound, and it's really the the unbound or free form of the hormone that is doing the quote unquote business end of what it's supposed to do. So I like looking in the saliva to see the active level of the hormone, because that's really going to help us gauge what is actually what's being used in the body. And that's why I tend to lean towards saliva testing, particularly with cortisol, which is the stress hormone we talked about, and as well as estrogen and progesterone, which are the main female reproductive hormones. And it turns out that there's a lab that we've worked with a long time that does this test. It's very affordable, in my opinion. It's just for a basic steroid hormone, which the steroid hormones, again, testosterone, cortisol, progesterone, estrogen, and DHEA. We can do that whole panel for about $125, which is pretty good. And we can get a nice real-time snapshot of where those hormone levels are of the active hormones in the body. Now, the way that we interpret that is really going to depend on what the clinical situation is, as well as what the age of the patient is. For example, with estrogen and progesterone, a estrogen and progesterone level that is premenopausal should be very different than a postmenopausal range. And if we are collecting female reproductive hormones, we also want to make sure, if it's a person who is in a menstruating age, that we collect it at a very particular time in their cycle, because those hormones also fluctuate through the cycle. They tend to peak right around day 20, which is where we like to collect it to appropriately assess it. Now, postmenopausally, those hormone fluctuations are very different, and the timing doesn't matter as much. So once we can, and then the other hormone in that assessment that works a little differently is cortisol, which doesn't have a monthly cycle, so to speak, like for women during menstruating age, but it has a circadian cycle, meaning a 24-hour cycle. And you probably heard the term melatonin. That's the counterpart to cortisol. Melatonin helps our body get quiet and go to sleep at night. Cortisol alerts us and wakes us up in the morning. So we like to test those hormones at their peak times. And so I tend to like to look at cortisol first thing in the morning upon rising. So in order to do this kind of testing, it's very convenient. We don't have to poke anybody's fingers or arms. We can have you fill up a tube with saliva. You can do it at home, and then you pop it in the mail to have a lab assess it. And from that information, we can glean a lot about, are your hormones functioning at an optimal level in terms of ranges? Are they in balance with each other in their function and expression? And how does that correlate clinically to what's going on with how you're feeling? So that's the situation and premise where I really like to use saliva hormones. I also use them frequently when I am monitoring someone who is taking hormones. Hormones are very powerful substances in our body. They have a lot of actions, and then oftentimes very powerful actions. So to me, it's important to, if I am especially prescribing them myself, to monitor the appropriateness and the balance and the concentration of those hormones in the body, since we are supplementing with additional hormone. And my personal approach to giving hormones of all types, including thyroid, but also reproductive hormones, is to use a bioidentical hormone, meaning the same type of hormone that your own body makes. Of course, it isn't made by your body, it's made synthetically in a lab, but it's derived from natural substances and it's the identical hormone that your body makes. So a lot of the drug-based hormones that are out there are synthetic, and the actual structure of that hormone is very different than what's in the body. And we tend to see that they lead to a lot more side effects, which are many, and I won't go into that. But that's why I approach, if I'm to use hormones, with the exact hormone that your body makes. Now, I might use a lot of other things to balance hormones before I consider giving additional hormones. We can look at botanicals, we can even look at food-based medicines. We can, of course, look at the causative factors. What's causing your body to make not enough progesterone? Great example of something I see is a really heavy stress response causing the body to essentially demand a lot of cortisol, which is the stress hormone, make too much cortisol, and steal that progesterone, which is an upstream precursor to how the body makes cortisol, steal your progesterone reserve. So that's a common pattern. It's a little example of how we start to interpret these findings. So I'd always ask that the finding of these types of testing be interpreted by a clinician or a physician, hopefully a holistic one that really will look at the big picture, knowing that putting the whole puzzle together is such an important thing. Testing in itself does very little for us. So that's a little bit about the salivary testing and why we might use it. And, again, I tried to point out a few examples, but menstrual irregularities, mood disturbances, energy issues, more female health-oriented conditions, women who are having a tough time going through perimenopause and going into menopause, experiencing hot flushes, night sweats, really big shifts in mood and energy, and hair, skin, and nail health. These can be very good times to take a peek at hormones. Even people dealing with mental health illness, anxiety, depression, or mild forms of that. The hormones, big players, right? They affect a lot of things. So these are areas to really pay attention. Another area a lot won't think about, but can be really relevant in regards to women and hormones, is osteoporosis, bone density, and the role hormones play in stabilizing and protecting our bone density. So this might be an occasion where we would consider looking at hormones if we were assessing what's causing low bone density. So I think that covers the saliva. Like I said, I want to touch on urinary hormone assessment a little bit, because I do think that it's a valuable placeholder for hormone testing. I don't use it a lot, but I do use it when I'm really curious what the body is doing with the hormones. And I especially think urinary testing is relevant in anybody that has a history of breast cancer or hormonal mediated cancers. Understanding how the body is detoxifying those hormones is really important. I think people who take hormone replacement periodically, it's really good to look at the urinary metabolites to see how the body what it is doing with those extra hormones you're adding to the system. So those are just a few areas why I might like to do urinary testing. And when I do the urinary testing, as I said, it shows the breakdown products. So it doesn't really show in real time how much the body is using. It's a little bit of an interpretation when we look at the urinary hormones to see that. So I think that we would probably more want to do that in the situation where, we really want to monitor hormone therapy or monitor what the body is doing with them, say, for concerning hormone-related pathologies like breast cancer or prostate cancer. So if I am doing hormone testing for reproductive hormones and someone's taking them, I like to monitor them about once a year, unless things are very unstable symptomatically for the patient. in which case I might do it more frequently. Also, if we're dealing with a more menstruating age issue, I might again do it more frequently than a year, but that's my typical testing pattern when I'm have someone using some hormones. And by the way that I do hormones primarily, we do carry some in office, but we most primarily utilize compounding pharmacies, which are able to concentrate the hormones, use really pure ingredients, and really tailor the formula, very individually to the patient with bioidenticals. So that will be more commonly what I choose to use. Regarding testosterone, I think it's important to mention that you need to carry a DEA license to prescribe testosterone, which is not something I'm ever going to or willing to carry for its cost and hassle. And I furthermore am very uncomfortable with supplementing testosterone because of the effects it creates on potentially exacerbating blood clots or the creation of blood clots in the body. It kind of scares me, and I've seen too many strokes happen with men on testosterone. And so if anything I do to support testosterone, I like to use its precursor called DHEA, which does a really good job of, I think, gently increasing testosterone when that's a desired outcome. So, just as a clarification, and I think, with testosterone, I said it's kind of a tricky thing because it's supposed to get lower as we get older. So I would say, a man in his 50s, probably a testosterone around 500 would be a really completely adequate one. Once it dips below 300 is when I really start to get concerned or feel that it could be impacting someone's well-being. And if it's, if someone's over 70 years old, I pretty much expect it to be below 300. I mean, that's a really normal level given that gradual age decline. I don't think I'm going to go into ranges too much with the female reproductive hormones because it's so dependent on the different stages of life someone is in regards to when and where you would want to have your hormones and what in relation to what. Meaning with women, progesterone and estrogen, right? They are complementary hormones that work with each other and in some ways oppose each other. And so we're always considering that duo, in my clinical opinion, is always important to assess that ratio. I tend to like to see with saliva about 150 parts progesterone to 1 part estradiol. That's kind of my favorite ratio optimally to look for. So, okay, we're right at 2 here, and I know that we've been talking a bit. There was one other question I wanted to engage that someone mentioned, which is the Lifeline or life screening tests. These tests tend to be mostly metabolic in nature and cardiovascular. So one thing I like about the Lifeline screenings that are in these little packages is that they do a carotid ultrasound test. And so that's really nice because it will give us some real-time evidence of if there is any clotting, or not clotting, but accumulation of debris in the arteries. Of course, that's a bad thing to have a lot of accumulation of debris in the arteries, because when those arteries close off or when that debris breaks off, we get heart attacks and strokes. Those are kind of the worst types of serious health things to have happen to us. So I really like, if it can be done, as an adult over the age 50, a carotid ultrasound, which is a little non-invasive imaging study over the skin surface, can be really nice to understand a little bit more about cardiovascular health. So we're wrapping on our time here, and I need to scoot out to my afternoon caseload. But I do kind of want to just throw out there that we didn't talk about a lot of other kinds of testing, and mainly because, we would probably need a couple hours to get through a really big subset of testing types. But we have other forms of urinalysis testing for metals that we like to do here. When the occasion's appropriate, we do various stool tests to understand what's going on in the gut a little more comprehensively in certain circumstances. We do blood spot tests, finger pokes, to take a peek at food intolerances, and we look at antibodies for food allergies there. Um, so that can be a really valuable tool when we're not sure what's happening in terms of the body being irritated by a food. We also will do breath tests to assess for overgrowth of bacteria in the gut. That's another really helpful tool on occasion um, when there's a lot of bloating, gas, distension, GI symptoms. We can do neurotransmitter testing via urine. That can be helpful in certain cases where we're looking at cognition. Um, and let's see, we can do a little hair assessment. I don't do that very often. So there's a few other things that we can take a peek at, but those are just a few things that I hope will kind of wet your whistle in terms of knowing a little bit more expansively about our naturopathic way of understanding what's going on inside the body. And so, as I said, we did record this. I'm presuming Bailey, our media person, is going to post this in our social media forums, Facebook, Twitter, website. So hopefully you can grab that there if you'd like to. And I appreciate you all coming on and hope you have a beautiful rest of your day on this gorgeous spring day. Thanks so much.